Welcome back to Arise Health TV. We will be talking about blood cancer, everything you need to know about blood cancer, and also how you can keep yourself protected. Before we start, don't forget to subscribe to our YouTube channel. Blood cancer, which is also known as hematologic cancer, is a type of cancer that affects the blood, bone marrow, and lymphatic system. It occurs when abnormal blood cells grow and multiply uncontrollably, disrupting the normal functioning of the blood and immune system. Symptoms of blood cancer. While each type of blood cancer is different, they can share some common symptoms and signs. Some people with blood cancer may not have any symptoms until the disease has advanced, or they may also mistake the symptoms for a severe cold or flu. Some common blood cancer symptoms include coughing or chest pain. Possible cause is a buildup of abnormal blood cells in your spleen. Frequent infections. Possible cause is not enough white blood cells to fight off routine pathogens. Fever or chills. Possible cause is not enough white blood cells, leading to more frequent infections. Unexplained rash, bruising, or bleeding. Possible cause is not enough platelets, which are the cells that help the blood to clot. Itchy skin. Possible causes remain unknown. Loss of appetite or nausea. Possible cause is a buildup of abnormal blood cells in your spleen so that it presses on your stomach. Night sweats. Possible causes remain unknown. Persistent weakness and fatigue. Possible cause is not enough red blood cells, anemia. Shortness of breath. Possible cause is anemia. Swollen, painless lymph nodes in the neck, armpits, or groin. Possible cause is a buildup of abnormal white blood cells in your lymph glands. Types of blood cancer. The three main types of blood and bone marrow cancer are leukemia, lymphoma, and myeloma. Leukemia is a blood cancer that originates in the blood and bone marrow. It occurs when the body creates too many abnormal white blood cells and interferes with the bone marrow's ability to make red blood cells and platelets. Non-Hodgkin lymphoma is a blood cancer that develops in the lymphatic system from cells called lymphocytes, a type of white blood cell that helps the body fight infections. Hodgkin lymphoma is a blood cancer that develops in the lymphatic system from cells called lymphocytes. Hodgkin lymphoma is characterized by the presence of an abnormal lymphocyte called the Reed-Sternberg cell. Multiple myeloma is a blood cancer that begins in the blood's plasma cells, a type of white blood cell made in the bone marrow. Learn about the stages of multiple myeloma. Less common forms of blood and bone marrow cancers and associated disorders include those listed below. Myelodysplastic syndromes, MDS. These are rare conditions that may result from damage to blood-forming cells in the bone marrow. Myeloproliferative neoplasms, MPNs. These rare blood cancers occur when the body overproduces white blood cells, red blood cells, or platelets. The three main subcategories are essential thrombocythemia, ET, myelofibrosis, MF, and polycythemia vera, PV. Amyloidosis. This rare disorder, characterized by the buildup of an abnormal protein called amyloid, is not a form of cancer, but it is closely associated with multiple myeloma. Waldenström macroglobulinemia. This is a rare type of non-Hodgkin lymphoma that starts in B cells. Aplastic anemia. This rare condition occurs when key stem cells are damaged and can only be treated with a bone marrow transplant. When to see a doctor. Since many early cancer symptoms are not very specific, it can be hard to know when you should feel worried. But early diagnosis can lead to earlier, more effective treatment, so don't delay. You should see your doctor if any blood cancer symptoms last more than a couple weeks without improving. Some people worry about bothering their doctor if they do have just a cold or flu. But your doctor would much rather see you promptly to make that diagnosis. Tests to diagnose blood cancer. Tests and procedures to diagnose blood cancers may include blood tests, bone marrow tests, imaging tests, CT scan, PET scan, and X-ray. Physical exam. Surgical lymph node removal to use in staging. Staging blood cancer. Staging is a process that tells the spread and severity of cancer. It lets each member of your care team know the exact type, location, and spread of the cancer. Doctors stage solid tumors, like lung cancer or breast cancer, by measuring tumor size and disease spread. But blood cancers are different. Each type of blood cancer uses its own staging system. Your doctor will explain how they decide the stage of your blood cancer. In general, blood cancer staging looks at blood cell counts, including the number of healthy cells, the size and number of cancer cells, genetic mutations in the cancer cells, the presence of cancer cells in other organs, bone damage with leukemia and multiple myeloma, enlarged liver or spleen. Doctors also assign a grade to non-Hodgkin lymphomas. Grading helps understand the cancer's growth patterns and aggressiveness. Lymphomas can be low grade, slow growing or indolent, intermediate grade, moderate growth rate, high grade, fast growing or aggressive. Chemotherapy. Chemotherapy is a primary blood cancer treatment, killing cancer cells to either slow down the disease's progress or eliminate the cancer. Healthcare providers use different drug types for different blood cancers. Radiation therapy. Healthcare providers may use radiation to treat leukemia, lymphoma, or myeloma. Radiation targets abnormal cells, damaging their DNA so they can't reproduce. Healthcare providers often combine radiation therapy with other treatments. They may use radiation to ease some symptoms. Immunotherapy. This treatment uses your immune system to fight cancer. Immunotherapy may help your body make more immune cells or help your existing immune cells find and kill cancer cells. Targeted therapy for cancer. This cancer treatment targets genetic changes or mutations that turn healthy cells into abnormal cells. CAR T-cell therapy. In CAR T-cell therapy, healthcare providers turn T-cell lymphocytes, a type of white blood cell, into more effective cancer treatment. Healthcare providers may use CAR T-cell therapy to treat B-cell acute lymphoblastic leukemia, multiple myeloma, and several types of non-Hodgkin's lymphoma if other treatments haven't worked. Autologous stem cell transplant. Healthcare providers can collect and store bone marrow stem cells before administering high doses of chemotherapy. Once chemotherapy is done, they'll replace the protected stem cells. This way, people having autologous stem cell implants can avoid chemotherapy side effects. Allogeneic stem cell transplant. Sometimes, damaged bone marrow needs to be replaced with healthy bone marrow. Healthcare providers identify a suitable bone marrow donor and use the donor cells to replace your damaged ones. This is an effective but dangerous procedure. If you found this teaching helpful, don't forget to subscribe to our channel. Don't forget to like and leave a comment so that people who need this tutorial can get it.